Everyone. I am going to go live with my daughter, Emily Samuel. She's never done an Instagram live before, and is a psychotherapist, and she's joined me, so I can see her there. So I just need her. I've invited her, and I think I can hear her. There you are, my darling. Hi.
Hi, I feel like I'm very close to the screen now.
There, you're perfect.
Sort of like half my head chopped off.
So I have not done an Instagram live on my account with a member of my family before. So this is a new thing.
Yeah, it feels a bit strange.
It is a bit strange. But the reason we're doing it is because you are a child psychotherapist,
Yes.
and I'd love you to talk about your training and sort of where you were and now where you've got to, so that we can learn more about you and your
Great.
work.
Yeah. So I am a UKCP accredited child psychotherapist. My training is what's called integrative, which I still can't really pronounce, even though I trained like 13 years ago.
Yeah.
Basically what
So
it
you've
means
been
is that
qualified for a long time.
I've been qualified for a long time. I've been qualified since 2013.
Yeah.
And sort of working clinically most of that time. And what integrative really means is just there's lots of different strands of therapy, and that's sort of incorporated into the training. A lot of like attachment-based stuff and neuroscience-based stuff. And where I've been really lucky is that I've also had the opportunity to also be trained in various other types of therapy. So I'm also trained in cognitive behavioral therapy and dialectical behavioral therapy and another thing called child parent psychotherapy. So there's sort of lots of different strands to what I do. And what's really fantastic for me about that is that it means I can really individualize treatment depending on the family and the family's needs. So
Can I pause you one moment to
Yes.
kind of talking about attachment therapy and cognitive behavioral therapy and parent therapy? Do you want to give a kind of couple of lines about what that means, so that people who, if they're thinking about friends of theirs with children, or what, your integrative, which gives you an understanding of attachment therapy, for
Mm-hmm.
instance?
Yeah. So, I mean, attachment-based therapy, sort of lots of practitioners have a kind of attachment base to their practice. And what it sort of means is it's really thinking about your primary relationships from your earliest experiences and what those attachment relationships were like with your parents or your primary caregivers, and how you then often use those as a template to go and repeat in later life.
And you often do it unconsciously, don't
exactly.
you? I mean, you think you're doing it differently, and then it's like, oh my God, I've married my
Yeah, and you can even be trying
unavailable
really,
dad.
really hard to do it differently.
Yeah, yeah.
And so sort of particularly with children, the idea of thinking about it through the lens of attachment is thinking about if we can make those early attachment relationships as strong as possible, as secure as possible, and as safe as possible, then those children and those young people can then go on for their future relationships and have that as a really positive template from which to then create relationships in later life. So that's not just romantic relationships, but also thinking about being resilient in the work environment, being resilient with peers. So it's sort of thinking about how can we make this child or this young person have as sort of as positive a template as possible for them to also be able to recognize when something's not good, when they're in a relationship that isn't positive, that is toxic, and to be able to know what that feels like. And so that's a sort of foundation stone of lots of the attachment work that I do and the thinking behind.
That's brilliant. And one of the things that I think is so kind of vital about jobs like yours is that research shows very clearly that the earlier the intervention, the more likely the outcomes for the child are positive. So that the more that because the brain is plastic, but the 0 to 5 years are the kind of most brain attachment theory shaping. But even when you see a child at say 12 or 13, you can still, because the brain is plastic, you can have an intervention and work with the parents that will then kind of take them off a road that was potentially very self-harming, and bring them back on a road of security. And Victoria Silver is saying, and everyone do ask questions.
Oh, I
Do
don't
you
think
practice EMDR?
I don't. I would love to be trained in EMDR, but I'm not at the moment. I think it's really fantastic. I know from firsthand how transformative it could be. But I mean, and I think to what you were saying, Mum, is that it also means that a young person, even if they've had really, really difficult experiences and really difficult relationships, because their brain still is still more plastic, it also means that that can be repaired. I mean,
Yeah.
it takes like work and effort, and it also means that as a parent, you have like some things that you're kind of empowered to do to help your child or the young person that you are looking after. And I think that's sort of something that's really mostly great about my work, and also can be difficult because that child and that young person doesn't have control of lots of aspects of their life, and that can be a challenge as well.
So, given that you have all these different trainings, and you worked in Yale at the Yale Child Study Centre,
yeah,
for a really long time, 9 years,
nearly 7 years.
7 years.
Not quite that long.
Know.
You're aging me up. I worked then nearly 7 years in the outpatient psychiatric clinic for children as a clinician there.
So what was the clinician sounds so much better than therapist.
I know, right? Well, that's just the words the Americans use. It wasn't
I wish I was a clinician.
A clinician, yeah.
But
I mean, I was
write
just
to me
a
as
child
a
like
doctor,
that.
and I wish I could say I'm a doctor. But anyway, what was the kind of patients that you saw yeah?
Yeah, so I saw a very broad spectrum of clients of ages and presentations. So I was in the early childhood team, which means I saw children and their caregivers under the age of 5. And that was quite relational work on the whole, because, you know, how much can a 2-year-old so that was always with a parent. It was dyadic work.
Will you say what kind of thing that was? So give us an example.
So a lot of those cases were referred through often courts, and a thing that they have in Connecticut called the Safe Babies Team, which is when a child or an infant under the age of 3 has experienced abuse. And the work was primarily, it was trauma. So the young person or the baby had experienced some sort of trauma, and the work was really with the parent or the caregiver to help their baby or the really young child to sort of help feel safe and kind of repair from the trauma. And that was a very specific intervention called child-parent psychotherapy, which is a dyadic, which just means 2 people intervention, which kind of focuses on using the relationship, because children that young are in, like, the way they operate is in relationship, to process the trauma that they've experienced and reduce some of the symptoms they're having as a result of the trauma.
So, I mean, as you're saying that, I'm imagining a baby that kind of, a 2-year-old that's not just having tantrums, but is completely losing it because they've experienced trauma, because something terrible has happened.
Yeah.
And so working with the mum or dad, the carer, you're working with them about how to soothe the parent first, in order to be able to soothe the child, because obviously we get ignited, you know, when you see a screaming child, it kind of makes us want to scream too.
No, I mean, I think exactly. This is really also goes to the point of your book, Mum. So every family has a story. Often a parent's reaction is informed by their own experience. So for a sort of fairly common example would be a 2-year-old who is maybe acting out a lot, who has witnessed some domestic violence. The mum comes in with the 2-year-old, and when the 2-year-old is hitting her in the face or being aggressive, the mum's own trauma history is then being activated, and so she becomes very, very dysregulated, and she's seeing the 2-year-old not as a 2-year-old who's experienced really, really scary, overwhelming things. She's seeing the 2-year-old as an aggressor.
As
and
a
so a lot of
perpetrator.
the work was also about helping the parent or the caregiver recognize their own history of trauma, and to be able to separate that out from the child's behavior in order to be able to address the child's behavior and also think about where this child's behavior is coming from. And I think the important thing about it was never about judging a parent or a
Yeah.
caregiver to their response in the situation. It was about like, this is a very like understandable reaction, but helping them recognize it so that they are better able to help the child.
Because also, as I'm thinking about that as an example, of course, when you've screamed at your baby, which I probably did at you, you get then this terrible, you know, as you calm down and you've been deactivated, as it were, you have this terrible self-loathing and shame and sense of failure. And of course, that sets a negative spiral as a parent. Whereas if you can have a third eye, like you explaining what's happening, and you can say to yourself, okay, you know, my trauma was activated, I acted out, but I'm learning how to change myself. And you can be self-compassionate and self-soothe, then you don't kind of make everything worse by going down such a negative cycle.
Yeah, and also not making negative attributions to your child's behavior. Like a 2-year-old is not doing this on like intentionally to make you really angry. Although as a mother of a 2-year-old, it's sometimes hard to believe. They're doing it because they have a need and they're expressing a need, and your job as a parent is to contain the feeling and try and address the need as much as you can. And you might not be able to meet the need, but you can sort of contain it as best as you can.
Do you want to talk about containment?
Yeah, I mean, so containment is
I'm very impressed, by the way, because we do talk about therapy a bit, but we've never really talked about your caseload that much, so this is fascinating for me. I'm really interested, and I am very impressed. I mean, I am biased, obviously.
You are definitely biased. I mean, containment is really exactly like how it sounds. Is effectively kind of helping your child regulate, and that is not just toddlers and young children. That can be your teenager who is completely driving you nuts. It's kind of absorbing the emotion that they are having, that you are then feeling, and helping to process it and kind of help regulate your child or whoever you're with. Actually, it kind of works with adults as well. And by containing it yourself and processing it yourself, you are then helping regulate your child by naming it, by remaining calm, by kind of doing the sort of murky work of processing really difficult emotions.
So an example, so your 14-year-old has been bad at school. You've told them they can't go out on Saturday night with their mates. They're screaming at you saying you're a terrible parent. Everybody else lets their parents go out. And so if you're containing that fury and the kind of kickback, what you don't want to do is scream back.
You don't want to scream back. And
so you want to time out. You want to time out yourself. I mean, I remember you saying to me, and me thinking, "Oh, did I do that? I'm not sure." But I remember you saying to me, often it's more important for the parent to take a time out than to put the child in time out.
Yes, I mean, I don't think timeout's particularly effective for children, but sometimes if as a parent you are about to lose it yourself, like have a timeout for the child so that you can have a few minutes. And I think the other thing is that when your child is really in the throes of a massive tantrum, or your teenager is like completely,
they're not available.
I hate you. Doing all the things that help emotion regulation in that moment probably aren't going to work. Like saying, I can see that you're really angry with me right now. Like that's not, like your 14-year-old is not going to listen to that. Your 2-year-old is probably not going to listen to that. And so the only thing you can really do is ride the wave of the emotion is that in that moment and help them calm down. And when they're in a calmer place, or like, for example, when your toddler hasn't completely lost it, but is just, you can see that they're getting angry, that's the time to name the emotion. That's the time to kind of help them process it. When anyone has completely lost it, like nothing you're going to say in that moment is,
because you're not available. Your networks are on fire. You're in fight, fright, or freeze. You have no receive button whatsoever. And so But what's important is to stay present, isn't
Yeah,
it? Because
and stay
often you want to
calm.
go out and slam the door. I'll come back when you've sorted yourself out. And that
Yeah.
is the sort of, that escalates it because you're abandoning them and punishing them in a way for expressing their
Yeah.
fury.
So, and I know it's really hard, but to
It
stay
is
calm,
hard. Yeah.
I think
And
it's,
also forgive yourself for the bad day, right?
yeah, yeah. I mean, like for me,
She says to her child, like,
yeah,
forgive me for the bad
it's
day.
okay to have the bad days. Yeah. I mean, I think, yeah, I like the sort of good enough thing. I think is always very helpful. Like as long as you're sort of good enough most of the time, it sort of should be okay.
That's my mantra, I must say, good enough.
Yeah, same.
Um,
So, I mean, that's a lot of the work that I did with younger children. With older children, I did the sort of, they presented with all sorts of different things. So, sort of mood disorders, depression, anxiety. I had quite a few selectively mute children.
selective mute children.
Selective mute
Oh,
children.
whoa. Who had been so traumatized that they couldn't speak.
I know they just for various different reasons would speak. I mean, sometimes it was trauma related, but sometimes there was just lots of different things happening that meant they spoke in the home environment but wouldn't speak at school at all. And often for things like that, sort of exposure therapy is really, really helpful, which is a much more directive form of therapy than lots of kind of play therapy, which you sort of usually associate doing with children. So what you do is kind of, and like similarly for obsessive compulsive disorder, the gradual exposure therapy
Is it a bit of CBT? Is it like cognitive behavioral therapy in a way?
It's more like cognitive behavioral therapy. Yeah, I think it's an aspect of cognitive behavioral therapy where essentially you're like, okay, so you, for example, for a child who is selectively mute, you might give them images and they have to go around and get 3 people in their class to like tick a thing off their piece of paper, like what's your favorite color, and they have the list of the favorite colors, and that's like the first step. And then the next step
To
might
kind
be
of
like
get them out of their comfort zone
exactly
and
like
try and
making
do
eye
that until
contact. Then you work up to like maybe mouthing, or maybe whispering, those sorts of things. So it's
feels very
much
tender,
more behavioural.
but it is behavioral.
It is behavioural.
But
I mean, obviously, you're thinking about the reasons that this child is selectively mute as well, and helping them with that.
definitely.
But yeah.
So now that you're back, do you want to explain why you're not in Yale and where you
Yeah.
are and
Yes.
starting your practice as a child psychotherapist?
Yes. So I left Yale at the end of 2019, which was when I had a baby, and then I had another baby. So the last, I had sort of 2 babies in 20 months. So that's what I've been doing. And now, and part of that was also COVID and lockdown and relocating to England. And so now I'm actually in Bath, and I've just set up a private practice where, which is in Central Bath, where I am seeing clients in person, and also those sort of 10 and over also online. So sort of I'm doing a mixture, which I'm really excited about. I'm very excited to be going back to work and doing what I love, really.
Yeah, I mean, that's amazing that you are. And, you know, we know from all the statistics that young people, partly because of lockdown, and I think it was something that was worsening already, their levels of anxiety, eating disorders, self-harm has escalated. And do you have any kind of thoughts about that? Anyone listening who has children who are anxious, or
Yeah.
what kind of sense can you make of it?
Yeah, I mean, I think there are lots of, I mean, I think it's really hard to be a young person right now. I think it was always hard to be a young person, to be honest.
It's always hard being a teenager.
It is really hard being a teenager, and I think sometimes adults have the perception of like, well, you don't have a mortgage, you don't have a job, like what are you really worrying about? But there's a lot of pressure. There's academic pressure, there's social pressure, and then of course added to that, like teenagers now also have social media, which you really can't switch off from. So you can't just like go home and watch telly and not think about it, like they're sort of being like affronted on all angles at 24 hours a day. Then plus COVID, all the normal things that you would have wanted to do as a teenager, you couldn't do. So I think it's not really surprising that there's such a sort of massive increase.
What do you think? What's your kind of take on social media? Because some people kind of think it's the devil. I'm sort of middle ground. I think it has a real place.
I think it has a real place. I think for some young people, it's also great. For people with like really bad social anxiety, it's a way to have some kind of social interaction. I think for young teens, I think as parents, you can kind of help prevent the overwhelmingness of social media by like effectively policing it and being the fall guy. So like a 14-year-old saying, well, I can't be on this, I can't be on that because my mum won't let me. I think
set a boundary, you keep them safe.
Set a boundary, and then they can kind of blame you.
And you can be the bad guy.
Yeah. Than having to do it for themselves. Yeah. I think having an open communication, I think talking with your children about it from a really young age, helping them understand the pros and the cons, and helping them understand like the things that might make them vulnerable as a young person without totally freaking them out.
Yeah.
I think being honest with them in a sort of age appropriate way is usually the most helpful in most things. Sort of having an open communication.
And I think you being more alert to the kind of pitfalls of social media, in some ways you can begin to educate your children and put boundaries in place. Mm-hmm. In a way, parents who have like 16-year-olds now, you know, there was so much that wasn't known, and there was so much ignorance that we were kind of, all of us, in the dark. Exactly. And trying to put in boundaries after the fact is almost impossible. You always have to set boundaries before. Yeah. So the grief kid, who I know, hi there, she's just wondering what someone should be aware of or do to help if a child loses their primary caregiver attachment.
Yeah, I mean, I think that is a really big one. I can answer, but probably Mum would be a better person to.
You can answer.
I mean, if they've lost their primary attachment person, I think that it's going to be really, really difficult. There's not really a magic solution to it. I think the important thing is that they are told honestly about what has happened and not being sort of euphemistic. Obviously,
that's the big one.
That's a really big one. In an age appropriate way, along with not going into too much detail. Like, they don't need to know every single tiny thing of the autopsy, but knowing what has happened. I think, you know.
Can I just pause you there? I think for all of us, I mean, even me with you as an adult child, I think that boundary and negotiation between informing children and protecting children is a really difficult one, isn't it?
It is really difficult. Really, really difficult.
So just to name it as a thing, not that I have an answer, I just acknowledging that it's painful. It's difficult.
Yeah. And I mean, I think there are a lot of great resources, Child Bereavement UK being one of them, that has a lot of information. I think that most research shows that the thing that kind of predicts the outcome, like how well this child does and goes on to be resilient, is their other caregivers.
It is.
And how their other
unfortunately
react, how the other caregivers support them. And so I think it's also making sure that that caregiver, whoever is looking after this child now, has their own support, so that they're able to look after the child. So I think those are probably the two really, really main things. There's a lot of information out there about how children of different ages react. I'm not sure how old this child is, and it's not always obvious. So I think, you know, Mum, you talk a lot about how children tend to jump in and out of grief, and so they can seem completely fine one moment and they're playing with their Legos, and then the next minute sort of ask you a slightly like devastating question,
like, why did Dad kill himself, that sort of thing.
Yeah, exactly. And so that is a really, it doesn't, there's no sort of wrong or right way to respond to a caregiver dying. And so I think that's
And
helpful
Judy
to know.
is echoing what you're saying, Judy Knox, is honest communication and talking with the child who has lost their primary caregiver and
Yeah,
allowing them to express their grief, but also to let them know it's okay to be happy,
yeah,
as well as and to laugh. And we call that jumping in and out of puddles, that you can be
yeah,
really, really sad
yeah.
and you want to be a happy child.
And there's no right way to do it. There's not a wrong way to do it or a right way to do it.
No, I mean, I think the important thing you said is that the children, everybody needs the same truth, and then you can learn to live with the truth, however difficult that is. And that the family if you're thinking about another family or yourself, you mainly need love and support of lots of people, because it's very, very hard to do that alone.
Yeah. And I think people often have this idea that children are resilient and therefore like they don't feel as much, and
that's just not
children, like, yeah, like it doesn't mean that the rest of their life is going to be terrible.
No.
But they will feel as much as anybody else who who lost their person that they loved the most.
Yeah, totally. And Lavri Karmal Singh is looking after your sister who died of cancer, struggle to help them best. Is that looking after your sister's children? I think that is a real struggle when you're kind of not sure how much to be involved or what your role is. And I'm thinking maybe talk to the primary carer of the children, if I've got this question right, and ask them what they need. Your sister's children, yeah. So their dad, I would ask him, Carmel, how you can help. Don't expect him to mind read or you to know, but you could even offer different things. That can you help with practical things? Do you want to come? Shall I come once a month, once a week, and come and take the children and do stuff? Shall I deliver food? What do you need help with? And then he can tell you, because I think just offering help, tell me anytime I can help, people find very unhelpful, because their brain isn't really operating at its kind of full level. Hello, Archie Hughes Hallett, a friend of Emily's and mine.
Yeah, I mean, and the other thing that I would add to that is that also you can help him navigate how to talk with his children. Like, I don't know what he has told them. I don't obviously know like the full extent of the diagnosis, but I think probably a way that you could help is talking to him about whether they have been told, like how to tell them, what supports maybe they need, that you could kind of help him navigate through that. Or I don't know exactly your sort of relationship with him, but maybe that's like an area that you could support him in figuring out, because I imagine he feels pretty helpless and overwhelmed.
And you're brilliant, Em. I completely agree. But also to acknowledge that you're grieving too, and that there isn't a hierarchy in grief. There's that everybody in your family, your nieces and nephews, your brother-in-law, your parents, so many significant people are really grieving, and that you all need to legitimize your grief and support yourself, and then recalibrate as a family system how you support each other, given this devastating thing has happened to you all. So there's one more. I have 3 daughters who've lost their brother to a cruel form of leukemia last year at 17 years of age. We were all devastated. I'm so sorry. Of course you're devastated. That is really awful. I do hope that you can find and get the support that you need, and certainly go to Child Bereavement UK. So, tell us where you're starting in practice and how people can find you, and when you're available.
Yeah, so I am it feels like a weird segue to go from people's really difficult lives to be like, well, my website is
that is well noticed.
But yeah, no, I'm practicing in Central Bath on Tuesdays, Wednesdays and Thursdays. I have availability for Zoom clients over the age of 10. I have a website, and I'm also seeing clients in person if you happen to live locally, of any age. I have a website which is www.emilysamuelpsychotherapy.com. And yeah, I think that's it. Yeah.
So are there any other questions? I can't see any. Oh, here we go. I can't see any more. So my angel, lovely seeing you, and thank you. And thank you for all of you who joined us and for being so open. And I hope we will see you again soon. Lots of love.
Thanks.
Bye. Bye.